Hammertoes. What are hammertoes? This is an arthritic condition of the toes. What causes hammertoes? Poor fitting shoes. Shoes that are too narrow, too short, or too shallow will contribute to the formation of this deformity. High arched feet. People with very high arched feet are prone to hammertoe formation simply because the toes will begin to ride up over the metatarsal bones and then bend in such a manner to cause this deformity. Pronation. People who excessively pronate are subject to this problem simply because excessive flattening of the feet causes a muscle imbalance in the feet which causes the toes to bend. What then occurs is that the toe deformities become more pronounced and more painful. As podiatrists, we make a distinction between two types of hammertoes. Flexible hammertoes, which are basically crooked toes that can be pulled straight, even though they will not stay that way, and rigid hammertoes that are bent in the crooked position and will not straighten out. This is of importance when discussing surgical correction. Hammertoes will cause the following types of pain. Joint pain. Since the toes are bent out of alignment, this may cause a premature erosion of the joints of the toes resulting in arthritic pain. Corns. The pressure of the tops of the toes against the shoes leads to formation of a corn, or hard skin overlying the part of the toe that is constantly hitting the shoes. Bursitis. Along with the formation of corns, the constant pressure will also cause the toe to become red and swollen in that area and very painful to touch. This is usually indicative of a bursitis formation. Metatarsalgia. If the toe is very rigid, the tendons on top of the toe may also become inflamed, plus because the crooked toes put so much retrograde or backward pressure on the metatarsal bones, it can also cause pain on the ball of the foot. Treatment of hammertoes. Conservative care. Wear conservative shoes, to remove the pressure or friction on the toes, which would be to change your shoe style into something more conservative. Toe pads. You can certainly try toe pads, and there is no shortage of them on the market. I would strongly recommend you never use medicated corn pads. They also sell slings and other devices which you wear on your toes in an attempt to straighten them. The problem with these devices is that they may work while you actually wear them, but will never permanently straighten your toes, and they also tend to take up a lot of space in the shoe. Trimming corns. If the corn does hurt, it can also be pared away. For those of you reading this who may be diabetic or have poor circulation or are a long-term smoker, corns that get too big, that do not necessarily hurt, should be treated professionally on a periodic basis. The reason for this is that the corn puts so much pressure on the underlying skin it creates what is called pressure necrosis, and the corn and underlying skin will break down and usually become infected. This is especially dangerous when the circulation to the toe is compromised. Cortisone injection or anti-inflammatory medication. When your doctor makes a diagnosis of a bursitis on the toe, this is a bit more difficult to treat. Usually a combination of anti-inflammatory medication along with orthopedic padding will give temporary relief. Many times a cortisone injection into the toe can be very helpful, but keep in mind it can be a fairly painful injection. Surgical care. Surgical correction. There are a few different surgical procedures available to correct hammertoe deformities, most involving bone remodeling, but some can be nothing more than soft tissue procedures done in an effort to realign the toe in question. It is important to discuss your options with a qualified foot specialist. Read the complete article at www.foot-pain-explained.com/hammertoes.html.